Welcome to the Mind Behind the Curtain podcast, a show about the stories of incredible physician entrepreneurs who've navigated the chaos, doubt, and growth that comes with creating something new. In each episode, we'll pull back the curtain on their journeys, sharing the triumphs and struggles that led them to where they are today. I'm your host, Jenny Ekstrom, a physician, entrepreneur, and mentor. Let's take this journey together. It's time to explore the mind behind the curtain. Hello and welcome to Mind Behind the Curtain podcast. I'm your host, Dr. Jenny Ekstrom. Today's guest is Dr. Susan Hughes. She is an executive business and life coach who helps women rise when shift happens. Once a serial entrepreneur with a thriving independent practice, Dr. Hughes was forced to pivot after surviving a traumatic brain injury in 2013. Dr. Hughes empowers high-achieving women to navigate life's biggest disruptions and to go from impact to impactful. As a lifelong educator, she also continues to teach as a part-time clinical professor, bringing her passion for education into every room she enters. Join us as we go behind the curtain to hear how Dr. Hughes turned personal adversity into a mission to empower others. Well, Susan, it is so great to have you here today and to get to have you share your story with our Mind Behind the Curtain community. So thank you.
Thank you so much for inviting me, Jenny. I really appreciate the opportunity to talk with you and your audience at Uncluttered Mind, MD.
Thank you. Especially since you have gotten the opportunity to really be there from the beginning.
And that's been fun. That has been fun.
Yeah. Well, I know we briefly introduced you, just a few minutes ago, but if you wouldn't mind just introducing yourself to our community and sharing a part of your story.
Sounds good. I'm Dr. Susan Hughes. I am, first of all, a mom and a wife. I've got two awesome kids. I'm also a medically retired physician that may resonate with a number of people in your audience. And I also teach part-time at the medical school and work with brand new soon-to-be physicians and teaching them how to do histories and physicals in a trauma-informed way. My background, like a lot of the people here, I was crazy busy. I had horrible boundaries, was doing way too many things, was looking at options for new direction because I had lost me. I had lost the ability to really spend the quality time I wanted with my family. And it's amazing how the universe answers that. It was not the answer I was looking for, but it was the answer that I got. And that was being involved in a horrible car accident. Um, when we got hit, we spun, my head took the window, and I suffered orthopedic injuries, neck injury, shoulder injury, but most concerning, a traumatic brain injury. And I had no choice. I had to retire from clinical medicine. The ability to read was impaired, math was gone in a second. I had to relearn how to add, subtract, multiply, division. I figure I can use my phone for that. Algebra, yeah, whatever. That's gone. Silly enough, some geometry came back. I have no idea why. But I had to learn a lot of things all over again. And part of that process is you learn who's there for you and who's not for you. You learn how to have boundaries because I really couldn't spend more time with people. It was a limited amount of time that I could spend with people before it was just too overwhelming for my brain.
Mhm.
So I learned enormous amount, and my husband and I learned together because he had just finished cancer treatment. So I've taken a lot of those lessons that I've learned in being a disabled, even though I don't like that word, it's accurate, physician, and have used that to be able to help others when shift happens.
Tell me about what your world looked like prior to your accident, what you were doing in medicine and sort of that toolbox of expertise that you had cultivated at that time.
Sounds good. I had started a private practice from ground up. Like you, I was a, private practice owner, built it over the course of many years, to a 10 provider office, most of them being physicians, 10,000 square foot space, um, several million in revenue per year. I also started a medical spa that was an independent that was my own. I started a surgical center because I did all the procedures for our office. And because I just didn't have enough to do, I started an educational nonprofit helping kiddos with sensory processing disorders. My husband was the stay at home parent. We had two kiddos. The first one was premature and had some special needs. The second one also had, things that she needed from both of us. And life was chaotic. Life was absolutely chaotic. It was more than what I really wanted. I started the medical spa in part because I wanted to cut back my hours in private practice. And that didn't quite happen. That didn't quite happen the way I wanted. So I was busy. I had been on multiple committees prior to starting the second and third businesses, but I was very involved in the community.
So your accident happens, you have to make a pretty significant change. What did that look like for you?
It was scary. It was very scary. I remember this is probably a year and a half, almost 2 years out, talking with the rehab doc that I was working with. And he looked at me and he said, "Well, what is one thing that you don't have right now? If you couldn't get back what you had before, what would the biggest thing?" And I hadn't cried. I hadn't gone through all the emotional, and I looked at him, I said, "If I can't read fluently again, that is something I can't live with." Because by my bedside, I probably have 10 books that I'm reading. My entire house is filled with books, and my eyes weren't tracking together, and I could only read a few minutes at a time before they would totally fade out. I didn't care about algebra. I didn't care about division. I was good with not having to relearn that. But reading, that was huge. It took about 3 years of intentional vision therapy and work to be able to get back. They still fatigue at times. At times, I have to cover my eye, cover
Mhm.
my eye to be able to read. Um, but that was the biggest factor, that and the ability to recognize people. Now, you're well known in your community. Imagine if people came up to you and gave you a great big hug and said, "Oh, Dr. Jenny, I miss you," and you had no clue who they were. And yeah, we had to leave town. We had to leave town. I kept running into patients and the people that I'd know, and I didn't recognize them.
Mm.
So I never really got to say goodbye to my patients, which was hard. That was very hard.
One of the things that I have loved watching in you, and honestly, or obviously, I've now seen this many years down the road, but is how you have taken that experience and turned it into a way to empower other people. Can you walk us through like what that journey was like for you and how Bounce Highest came to be?
Absolutely. I call it my going from impact to becoming impactful moment. There are so many lessons that we learn as humans, as women, as physicians, as people moving forward. Shift happens. And I describe shift as anything that keeps you up at night or distracts you during the day. Shift happens. It doesn't have to be a car accident, or in my case, another car accident. I had another one almost 3 years ago, another traumatic brain injury. It doesn't have to have a spouse with cancer. It doesn't have kiddos with special needs. It can be anything. It can be, facing a malpractice case. It can be dealing with others in your practice that don't share the same vision that you do. It can be working with insurance companies. It can be missing your kids' games. It can be anything that keeps you up at night or distracts you during the day. And that to me is shift. And there's so many different flavors of it. And I took a lot of lessons that my husband and I had learned. And I want people to not just, you've heard the phrase bounce back from adversity. Well, it's more than that. It's being intentional about it and bouncing, not just higher, but highest. And that's what I called the business, bounce highest. And so I started coaching women one on one and have been doing that for, about 10 years. And through that journey, you see a lot of patterns. As physicians, we see things in patterns. We see things in technicolor too, but we see things in patterns. And I put a lot of those lessons into an on-demand course and to a workbook for people to use and do mastermind coaching as well as one-on-one coaching. Because I'm a serial entrepreneur, also have that executive business coaching and helping people learn how to set up their own businesses, learn how to find their niche. It's fun right now. One of my clients went from, being full time in the hospital to now being, medical director at different things. And she gave a really big speech yesterday. I was so excited for her.
Mm.
So their wins are my wins. And I love that. Absolutely love that.
I love that. Celebrating the wins of those around us is so impactful. And I think when one of us wins, we all win, right?
Absolutely.
Yeah.
Absolutely.
You've obviously described some of the personal challenges that you had with your health. What, as you've built this coaching business, what has that process been like for you?
A roller coaster. Absolutely a roller coaster. For me, especially with, all the surgeries I've had in the rehab, I get things are going great, and then I have surgery and rehab, and it slows back down. And then I get going again, and then I have more surgery and rehab. So it's been very frustrating. And I think that's part of the journey, recognizing that it's not always going to be smooth. We have ideas on what we want, and then the journey to get there is a big squiggle. So it's recognizing it's not going to be perfect, but it's important to take imperfect action.
Mhm. Taking those steps and learning the lessons, like even in that space of like you are living your shift happens constantly. So in that way, what a beautiful example it is to those that you're coaching, where you're not only providing a framework for them to learn, but saying, I'm doing this right along with you.
Absolutely. Absolutely. I mean, I had some people in my coaching program, and when I was in an accident almost 3 years ago, they got to see it up close and personal again.
Mhm.
So, and I think part of that is being an unapologetic traumatic brain injury survivor and being authentic and being able to connect with people, not just at the head level, but at the heart level.
Mm.
And that's so important. That is so important to be able to have that connection with people.
And what better way to know that we have to set boundaries than to have to do that because we recognize our limitations?
Oh, I don't like that. I do not like to recognize my limitations.
I don't think that any
No,
of us do, but
no, we
there is
don't.
I want to say that there's power in that though.
Right.
When we truly can't, because I think the folks that are drawn to medicine, physicians who are drawn to medicine, like we have lost a lot of that concept of what is reasonable, what we should expect of ourselves. I mean, just you like
Mhm.
creating a whole new business thinking that that was going to give you freedom. I mean, those are the kind of games that our brains play on us. So when we actually have to be in that place where we accept our limitations, and does dare I say that that limitation may bring freedom?
It does, depending on how you acknowledge it and deal with it.
Yes.
So I'll give you an example. Yesterday, I was doing part of my advocacy work, um, trying to do whatever we can to support Medicaid and those individuals who need are most vulnerable, are most vulnerable. And I was at a tent. I'm never confined in a tent. I was outside the tent talking to women, talking to people. And there were other people that were working with me. And one of them was a friend of mine, except she had a hat on, had her hair back, and had um, sunglasses. I didn't recognize her.
Mhm,
I worked with her for 2 hours. It
mhm,
wasn't until we started breaking everything down. It's like, oh God, I can't believe it. But there were so many people. And I said, I am so sorry. I said, I didn't recognize you. Even though, I've run into her several times before. We're Facebook friends. We, message back and forth. I didn't recognize her. And I had to say, I'm sorry.
mhm,
That's part of my brain glitch is it's difficult for me to recognize people.
mhm.
And she got it.
Yeah.
She got it. I did not like admitting that, but it was the truth. It was the truth. And sometimes, as you said, the truth will set you free. Um, we don't like to be vulnerable. We don't like to share behind the curtain. We don't like to share those innermost parts of ourselves, but it's who we are. Um, and I actually share it with my students,
Mhm.
which is it's good. It lets them see me as a human and it lets them see themselves as humans.
And that is exactly why I invite folks to this platform, because I really want us to see how uh, we are working and excelling in spite of, or even because of, our limitations, and what that brings up, what other opportunities that brings up for us, where you may not be having the impact you are having right now had your past experiences not happened. um, so it's a mindset shift, right? And it's probably a daily
Absolutely.
mindset shift, but all of us, whether those limitations are clearly visible or they're things that we keep protected and hidden away, I
Mhm.
think that just bringing that out into the light and recognizing that we all are limited in some way, um, and that can be part of what brings opportunities into our purview, I think is really important.
That's huge. And I've just got a quick story about that. It was probably a year and a half after my car accident. I still was having difficulty reading fluently. And I was invited to a event to speak in Los Angeles. So I was speaking from the stage in Los Angeles. And I remember telling them how grateful I was that my family wasn't hurt,
Mhm,
that, I was still alive, that I was not a paraplegic. And it hit me. I was grateful not just for being alive, but for becoming the woman I am because of the car accident. That was a huge, huge lightning bolt moment for me.
mhm,
I wouldn't recommend it. I
mhm,
wouldn't wish it on anybody. It forced me to slow down. It forced me to look at things differently. It forced me to be better with boundaries.
mhm.
It forced me to give myself grace, even though I'm still terrible at that. I learned a lot. I would not have learned all those lessons if I hadn't been injured.
Mhm. How does that experience change how you interact and instruct med students today?
How does that help me with working with medical students
Yeah,
today?
so just taking that, because my feeling is that potentially the way that you would have instructed medical students prior
Hmm.
to your accident, at the height of what you were doing in your practice with all of your business ventures, that you may have a different approach to them now, knowing what you know now and having lived
Absolutely.
the life you've lived.
Absolutely. I did have the opportunity to teach medical students and residents before the car accident.
Mhm,
Had them rotate with me in my clinic. The focus was on clinical medicine. The focus was really on listening to the patient. It's flipped around.
mhm,
It's flipped around. A number of the people that I work with and coaching are shattered physicians who spent their whole life doing, delaying gratification to become physicians to find it's not what they thought it was going to be. And some of them even have been suicidal.
mhm,
What I do with my medical students is, in a way, inoculate them, not indoctrinate, but inoculate. So there's a couple things that I teach them. One is to do a body scan before they walk into a room with the patient, or in the case that I'm working with them, they're the specialized trained patients.
mhm,
So take a deep breath and check in with themselves. Do you have a headache? Are you thirsty? Are you hungry? Do you need to use the restroom? Are you worried because your car is going to get towed because you didn't put enough money in it? I mean, just silly things. I want them to do a body scan and take a deep breath and kind of let some of that go. That way, when they walk in the room to talk with the patient, they're not bringing their crap with them. They're
mhm,
not bringing their tension, their anxiety, their fear. And so if they're going in with a blank slate and start talking to someone and they start feeling really anxious, it's going to be coming from the patient. And that's another tool that they can use to understand what's going on with the patient. Now, on the flip side, if they come in and they've not done a body scan and they're really stressed, the patient's going to feel that stress and the patient's going to get stressed. Then the medical student's going to get stressed. And it's going to be one of these ping pongs all the way up. And so I teach my students, check in with yourself,
mhm,
because that little, I mean, you get it. All the physicians on this get it. One of the best tools we've got in being able to deal with our patients is that little, I call it the fur at the back of our neck that lifts up when we're sensing something going on with patients. It's that intuitive, that honed sense. It's incredible. The other thing I work with my students on, we know about trauma informed care. We know about triggers. We know that triggers are words, sound, sense, things like that to just make you pause and put you in a bad space. I want to teach them sparkles. I call it sparkles. You can call it whatever you want. These are things that just make you laugh, that just get a temporary state change, whether that be playing a stupid little kazoo before we start a podcast or anything that just gets a little state change. So I ordered bone pens
mhm,
for all my students. So when they look at it, they just kind of crack up. And that gets a state change. I also bring stickers, I bring pins. I've got, one of my pins. The other side, I've got a pin right. You can see it. Anyways,
mhm,
I've got a pin there. And they're just little things to get a state
mhm,
change. And I show them how to use their physiology to also get a state change using that vagal nerve, whether it be box breathing or, whatever tools. These are things I didn't teach my medical students or my residents prior to being in the car accident. That body awareness.
mhm. Yeah, so powerful. And even as you are describing those things, I mean, those are tools that I have also learned to use with my patients. So I love that that is becoming some of the common language that you're using with students because you're absolutely right. We get in those places where we match energy, and um, I don't know if you've had any of your students that have done this, but I found it even in myself. Like there are times where I just say, I need to step out of the room so that I can do that. And I've given myself that permission so that it allows all of that energy to just dissipate. And it's fascinating to watch how patients interact with that and the feedback that can have there. So I love that you are incorporating into the language of teaching that you are doing with a new generation of medical students.
It's fun. It's not just my medical students, it's part of my advocacy work.
Mhm.
Um, I was at Capitol Hill the other day and, trying to meet with different staff members. Did you know that everybody loves stickers? And so I've got a whole box of stickers. Some of them are more medical designed. Some of them are just of silly cats. Some of them are just of clouds. They're just silly little stickers that you put on a water bottle. And you know what? You've got a staff member and they're trying to be, they've got their boundaries up. It's like, hey, would you like a sticker? Oh, what kind of sticker? You give them the
Mhm.
box, you let them choose what they want. Oh my gosh, they're all like little kids coming, all these interns as well as more seasoned staffers are going through the box to find these little stickers. And it's just a different way to make a connection
Mhm.
because that's
Uh,
what we all want to do, isn't it?
mhm.
We want to make those connections. We want to make that impact. We want to be able to support and lead
Mhm.
from the front.
So, so good. So, if you were going to leave our listeners with maybe one or two pearls about your journey and the impact that you want to have, what would those be?
You are enough. You are enough. Too often in medicine, oh, we are competitors. In life, we are competitors. That means somebody must win. And people that get second, and there are no participation trophies, we tend to compare ourselves to other people. I think one tidbit is you're enough. You're exactly where you are. If you are if you're getting into real estate and you have your house and you're talking to somebody else who may have, 2,000 doors, learn, but you are enough. You're where you're at in your journey. If so, it's you're enough, but also give yourself grace.
Mhm.
And that is so hard, but it's so important because we push ourselves. We tell ourselves, hey, you know, cowgirl up, you can get through this. Well, sometimes it's important to say, hey, can we postpone this? Can we do this later? I'm not able to do it right now and be my best.
Mhm.
And it's just so important, if you can remember those two things, you're
Mhm.
enough. Give yourself grace, um, and and read. Stay curious. That's number 4. Stay curious. Keep number 5 is asking questions. And that's about my done. Okay, I'm not going to keep going to number 10. I could, but
Love it.
stay curious. It was so much fun when my son was a little guy. It was always stump the mommy. My friends would be over, goes, Mommy, yes, Ethan. I have a question. What's your question? And he'd come out with this question. It was, much higher level than a little 5-year-old question. But stay curious, ask those questions, look for other opinions and read. It's scary when you look at the number of books that people don't read after college,
Mhm.
after medical school, after high school. Keep learning, keep learning.
You are such a natural teacher, and I just love seeing that come out. So thank you very much. So as our listeners have connected with you here during the podcast, like where can they find you?
The best way really to find me, just shoot me an email. I do have, presence on Facebook. I've got my private Facebook, and I also have a Facebook group. Um, on Facebook, the page is Bounce Highest. The group is Navigating Unexpected Obstacles. But my email at drsusan@bouncehighest.com is probably the best way to track me down. And if people just want to have a conversation, I'm offering to, your people listening on the podcast, we're like, I might need some help here.
Mhm.
What is a coach anyways? Just shoot me an email. We'll set up, 15-minute free conversation just to talk, see if it's a good fit. So it's Dr. Susan at bouncehighest.com. We'll keep it simple. We'll keep it
Great.
simple.
And we'll include that in the show notes as
Thank
well.
you. Thank you.
Well, thank you so much for joining us today. And it's always fun. Even though I've known you for several years, I always learn something different about you. So thank you for giving me your time today.
Thank you so much, Jenny. It has been a joy working with you over the last few years, and I truly am appreciative that I could get to share my story and some lessons with your audience. So thank you.
All right. Thank you for joining us on this episode of Mind Behind the Curtain. If you enjoyed today's episode, be sure to subscribe and leave a review wherever you listen to podcasts. And don't forget to share this with someone who needs to hear it, because often the answers we're searching for are already within us. For more inspiration and behind-the-scenes insights from amazing physician entrepreneurs, visit us at unclutteredmindmd.com or follow us on Facebook and Instagram at unclutteredmindmd. The curtain's always open.